Welcome, 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 folks! Tonight's show, we'll look at myths related to palliative and end-of-life care. And our judges, the wisest of the wise, the savviest of the savvy, we have brought them from across the country. A leading doctor, a renowned nurse, a distinguished social worker, and a famous researcher. Without further ado, bring on the first myth. Myth number 1. Palliative care is only for the last days and weeks of life.
Palliative care is not only for the last days and weeks of life. It should start much earlier.
Patients experience symptoms and quality of life issues throughout the illness, right from the time of diagnosis.
Palliative care should, at the very least, start as soon as the disease is deemed to be progressive and incurable. When done earlier, it is done alongside treatments to control the disease.
Research shows that starting palliative care early and not waiting for the last days and weeks of life results in a better quality of life, reduced depression and anxiety, and in some cases, a longer life expectancy.
Palliative care should start early when a disease is found to be serious and life-threatening. Makes sense. Our next myth. Starting palliative care means I'm dying.
As we've just heard, palliative care is not restricted only to the end of life. Many people would benefit from palliative care long before they are in the terminal phase.
Palliative care means focusing on improving quality of life and engaging in important discussions, no matter how long one has to live.
And don't forget, palliative care, when started earlier, can be done alongside treatments to control the disease. Enough of this negative talk.
Starting palliative care early means many more months of better quality of life. On to our next myth. Palliative care starts when there is no further active treatment available.
Palliative care is very active care. It requires treating symptoms using different medications and approaches, treating complications of the disease, making the right choices between different treatments and care goals, providing psychological and social support, and providing spiritual care. These are all active treatments.
Although controlling the disease may not be always possible, there is always a lot of active care to be done.
Palliative care is active care. Okay, next, starting palliative care means giving up.
Well, that depends on what you mean by giving up. When cure or control is still possible, palliative care is done alongside treatments that try to cure or control. When neither cure nor control is possible, palliative care becomes the main focus of care and is ongoing and active. It's not about giving up.
Starting a palliative care approach means that care continues. And now, our final myth for the evening. Palliative care means getting doped up with morphine until the end.
Let's make it clear. Firstly, morphine and other opioids are safe and effective medications when used appropriately to treat pain. The goal is to control pain and have a person clear of mind. Secondly, if a patient does become sedated as a result of using morphine or other medications, it would be a side effect that needs to be resolved. And thirdly, becoming increasingly sleepy and fatigued is a normal process of dying. Too often, morphine or other medications are blamed for this when they are actually innocent.
When sedation is needed, which is the case in some situations at the very end of life, sedative medications are used, not morphine.
The goal of palliative care requires effective and judicious use of medications. Well, that concludes our palliative myths for tonight. Be sure to tune in next time when we examine 5 more myths associated with palliative care.